Today on Diagnosing Health Care, we're discussing everything vaccines and the Trump administration. Hello and welcome. I'm your host, Will Walters. I'm an attorney in Epstein Becker Green's Healthcare and Life Sciences practice based out of our Washington, D.C. office. In this brief episode, we're going to cover vaccine related topics ranging from the measles outbreak, the reduction of force within the federal government, and reduced government funding of public health programs. Going to be honest, it probably won't be too uplifting of an episode, but trust us, there are lots of continuing efforts to ensure continued access to life saving vaccines. If you like what you hear today, please subscribe to the show. Diagnosing Healthcare is available wherever you get your podcasts. First, I'd like to introduce Anna Larson, an advisor and health services researcher out of our DC office. Anna is the only non attorney joining us today, so she will provide the balance we all need, as she always does. Welcome, Anna.
I'll do my best. I will.
Next up is Spreeha Choudhury. Working out of our Newark office, Spreeha is a pharmacist and an attorney, meaning she is the only member of her team who has actually injected a vaccine. Welcome, Spreeha.
Hi. Happy to be here.
Finally, our fearless leader, Richard Hughes. Welcome, Richard.
Thank you.
So, Anna, let's start with you. We've all been hearing about the measles outbreak in Texas. What do we know about what's happening on the ground, and how is that attributable to decreases in vaccine uptake?
Yeah, well, it's really sad what's happening. There are so many sick children. The latest count I saw had about 70 cases amongst children and adolescents. And as we know, measles is a really serious disease and can be fatal as well as cause severe illnesses such as pneumonia, encephalitis, things like that. In terms of the outbreak, it's not limited to just the Southwest, although it is concentrated in Texas and New Mexico. We actually see confirmed measles cases in the U.S. in 25 jurisdictions across the country. As of April 10th, there were 712 confirmed cases in the US, including 3 deaths, 2 in Texas, and 1 under investigation in New Mexico. What we're seeing is in West Texas, there are tight knit communities where there are pockets of under vaccination. So, an infected person comes with measles, and then because there are low levels of herd immunity, which means that there aren't enough people in the community that are vaccinated to prevent transmission, then the virus is spreading. So measles is widely considered the one of the most contagious infectious diseases. And, according to transmission models, up to 9 out of 10 individuals will contract the disease unless they are vaccinated. So what we're seeing is something really big happening in the United States, and it's really been unprecedented. We received our measles elimination status in the year 2000, and we're at risk of losing that status if we have up to a year or more of continued transmission. And we're really well on our way to getting there, unfortunately.
And how are exemptions from vaccine requirements playing into this?
Vaccine exemptions are playing a really big role here. While we see declines in vaccination coverage rates, we see increases in things like exemptions to state required vaccinations for kindergartners. This last year, that number was 3.3%. And while that seems like a small number, when you actually need 95% of individuals to be vaccinated to prevent transmission, 3.3% is actually quite a large number of people who put us at risk of further spread of disease. And in fact, as of last year's data, 14 jurisdictions in the United States have an exemption rate of over 5%, which means they won't be able to meet that target vaccination rate of 95%.
So you touched on this a little bit, but you mentioned we reached elimination status, which means we've eliminated measles in the country. That was back in 2000. Do you expect the elimination status to be revoked from the U.S. and how do we sort of stand globally amongst other countries in coming to terms with measles and decreased vaccination rates?
Many countries around the world have eliminated measles successfully, thanks in large part to vaccination. The measles vaccine has been around since the 1960s, and we really saw a rapid decline in measles incidence and disease over the last several decades because of that, because of vaccination. So it's really a huge success story here. But with that, there have been pockets of under-vaccinated communities around the world, and in fact, measles is spreading elsewhere outside of the United States as well. So, what actually happened was the measles case came in from outside of the United States and then has circulated since within the country. But it's really a harbinger of more to come, I would say. routine vaccination took a big hit during the pandemic and to some extent has recovered, although there are real pockets of under vaccination around the world, and measles continues to be a big challenge. So I think that in the United States, we have a bit of a unique situation with the issue of vaccine hesitancy and some of the other challenges. In general, we have a strong immunization program and high coverage rates compared to other countries, but what we are seeing is a backsliding in routine vaccination coverage more broadly, and measles is just one example of that. Unfortunately, we're seeing the dire consequences of that now.
Thanks, Anna. So, turning to you, Spreeha, the Advisory Committee on Immunization Practices held its first meeting under the Trump administration this week. Quickly noting what the ACIP is for those of our listeners who may be new to vaccines, how has this meeting been going, and why is it significant that it even happened this week?
Yeah, thanks for the question. So, definitely start with the basics. The Advisory Committee on Immunization Practices, or ACIP, which was founded in 1964, is a group of independent public health experts who advise the CDC on which vaccine should be recommended for routine use in the United States. So, this group of public health experts and medical experts review the latest evidence on safety, effectiveness, and public health impact, and their recommendations really play a critical role in shaping which vaccines are covered by insurance, offered in clinics, required, like Anna said, in schools or other workplaces like healthcare facilities. So, over time, the ACIP's role has really expanded beyond guidance and form a foundation for things like the federal Vaccines for Children program, which provides vaccines to nearly half of all children in the United States. In 2010, the Affordable Care Act amended the Public Health Services Act to require that ACIP recommended vaccines that are then adopted by CDC be covered by most private health insurance plans with no out of pocket cost. In short, the ACIP's decisions don't just influence public health, they really determine which vaccines are actually accessible to people through their insurance plans. So, ACIP typically meets 3 times a year, usually in February, June, and October. During the COVID pandemic, they met several more times than that. So that schedule does change from time to time, but usually just like in a pandemic type setting. But outside of that type of setting, usually meets 3 times a year. Recommendations from those meetings are not considered to be in effect until they're adopted by the CDC director and then published in CDC's Morbidity and Mortality Weekly Report, the MMWR. And that can take anywhere from a few weeks to a few months. So, going back to your question about the meeting that just happened over the last few days, it's significant for several reasons. So, firstly, it was postponed from the usual February date until about mid April, making it the first time that the ACIP met under the Trump administration since RFK was confirmed as Secretary of Health and Human Services. Secretary Kennedy has a really long history of casting doubts on vaccines. And although he hasn't made any, sweeping policy changes yet, his confirmation has really introduced some uncertainty into how federal vaccine policy is going to evolve over the next few years in this administration. So, when the February meeting was delayed, a lot of people in the public health community were genuinely concerned that ACIP might not meet at all. So, the fact that the meeting happened and that ACIP was very much business as usual, reviewing evidence and making recommendations is really important. It's showing that, for now at least, the public health infrastructure that supports vaccination is still intact and moving forward. But that being said, there's a lot of concern about how long that independence that ACIP has is going to last. One of the issues is leadership. President Trump nominated the current acting CDC director, Dr. Susan Minares, to serve as the permanent director. However, a nominee cannot continue serving as the acting official for the role for which they've been nominated, which basically means that CDC doesn't have a director while that ACIP meeting was happening. Um, and that means that Dr. Minares will not be able to adopt the ACIP recommendations that came out of that meeting in the interim. If the CDC doesn't have a Senate confirmed or acting director, then HHS Secretary, Secretary Kennedy, would be left to authorize the ACIP recommendations coming out of the meeting to make them actually effective. And he may, of course, choose not to do so. So this week's meeting was not just about the vaccine recommendations on the table. It's a test of whether, these processes that have really governed public health policy for a long time will continue to hold. And I think experts and advocates like us, our team, are really watching closely to see how political pressure might start to influence the process going forward.
And Richard, anything to add there? I can feel you looking into the camera with passion as Spreeha was talking about ACIP.
I would just say that ACIP does play a very pivotal role. It's been around for 6 decades. It was created, really with this role to simplify vaccine recommendations and make them more implementable in practice. And over time, Congress has increasingly looked to ACIP, as Spreeha said, to determine health insurance coverage requirements. States refer back to it when they're determining their own immunization policies or things like which providers can give vaccines. And, yeah, as Spreha said, there was a lot of concern about whether the committee would be able to continue its work. I think that there will be an ongoing concern about what the membership composition looks like, what sort of views are represented there. Will they continue to be grounded in real science, or will we see the introduction of alternative views, junk science, anti-vax sentiments at the committee? And that could be incredibly disruptive for vaccine schedules, for recommended vaccine schedules. And really whether we can continue to protect children and adults from vaccine preventable diseases, or, if we'll see more outbreaks like the measles outbreaks that Anna described.
I want to add one thing really quickly to what Richard said because I think it's really important. If for some reason ACIP membership changes or this coverage requirement goes away, this doesn't mean that vaccines will leave the market. The vaccines will still be on the market, but it's the access to the vaccines that's going to be limited, which then may lead to a health equity issue. It's going to be the people who can afford to get vaccines are going to be able to get vaccinated, and the large majority of people and children who aren't able to afford vaccines are going to have to be unvaccinated and get sick.
That's a really good point. Continuing with you, Spreeha, how about zooming out from the ACIP and the rest of CDC and even HHS? We've been hearing a lot about reductions in force of the United States federal government, specifically within administrative agencies. What are we hearing about that, and how is it affecting the vaccine ecosystem?
Yeah, sure. So, like you said, there's reductions in force across HHS and CDC, and they're having a serious chilling effect on our national vaccine infrastructure. Earlier in April, HHS started cutting 10,000 full time positions and restructuring dozens of agencies and consolidating vaccine related functions into a new entity called Administration for a Healthy America. So, on paper, it's really about efficiency, but in practice, it's really destabilizing the agencies that we rely on to oversee vaccine safety, funding, access, emergency response during pandemics. This is going to lead to a loss of institutional knowledge from, if people get fired who've been there for a very long time, slower responses to outbreaks. The COVID-19 pandemic did not happen that long ago. It's still recent history, and now there's measles outbreaks. It's also going to cause massive disruptions in programs like Vaccines for Children, like I mentioned earlier. At the FDA, switching gears a little bit, the loss of leadership and staff is already delaying product reviews and further undermining confidence in new vaccines. And then, Will, like you said, the NIH is facing grant cancellations, specifically for research into pandemic preparedness. And I think most concerningly, vaccine hesitancy. We're hearing reports of people who have gotten grant funding, the grant getting revoked because they've done like a control F search for vaccine hesitancy buzzwords. This is really concerning that this is happening just as we're also seeing measles outbreaks and rising skepticism about vaccines nationwide. Researchers are losing funding, staff, the ability to plan long term projects that support innovation in vaccination. We're not going to see new vaccines coming to market. So, all of that to say, the infrastructure that supports vaccination, all the way from discovery to delivery, is being dismantled piece by piece. And if these reductions in force continue, we're going to see a real decline in vaccine uptake, and also in our ability to develop, approve, and distribute vaccines that we need to stay healthy.
Thanks for it. A lot of great detail there. But Richard, just to go even deeper into it, you and I have been shooting articles back and forth on what's happening at the FDA and why staff reductions there, even despite how the user fee system works, might slow things down even more. So, want to share some detail on that?
Yeah, so I do think, as Spread described very well, across the federal government, these efforts to create efficiency or reduce the overall federal workforce are going to hamper many functions and their ability to just to do their basic jobs, right? And at the FDA, there's a very important role that the FDA plays in exchanging scientific evidence with manufacturers, with developers of vaccines. And this isn't a conflict of interest, as Robert F. Kennedy Jr. has intimated, but it is very important that the FDA is able to have that scientific exchange so that it can ensure that at every phase of development and testing, that the science is on track. And then ultimately to evaluate those applications, those biological licensure applications before they approve a product. And so it's very important that there's a line, there's an open line there with the FDA. And what we're already seeing is those lines are being disconnected. And a lot of this is because, staff are being eliminated at certain levels. There's going to be a brain drain across much of the health enterprise in the United States, and that is true at FDA. And then you have this issue of funding and just the balance of funding at the FDA. So under the Prescription Drug User Fee Act, it really created this system so that companies pay dues in order to really give the FDA the funding and the resources so that they can create the capacity to review drugs and biologics on time. And so there are these timelines that are set up where once an application is submitted, the FDA has a certain amount of time to review and deny or approve the application. And what we're already seeing is even where there have been indications that a BLA, the biological licensure application, is going to be approved, that it's not. And so we're already seeing delays. And there's a question as to whether there are directives at a higher level to delay some of these approvals, to maybe revisit whether they will be approved, or if it's something in terms of capacity that's stalling these. And I think the answer could be it's both. And so if the FDA is seeing funding cuts, that presents a problem because there's this balance where the agency is not allowed to receive excessive amounts of PDUFA dues from the companies. That can't be, relative to government funding, too high. And so we're going to see a scenario potentially where companies are not able to pay these fees when they submit their application, which is going to create the same capacity issues that the agency had before PDUFA was passed.
So, jobs aren't the only thing this administration is cutting. Sticking with you, could you tell us a little more about the termination of COVID-19 funding streams to the states and what that will mean for state public health departments?
Sure. So I think it's not unexpected that COVID-19 funds were a target for this administration. And so a few weeks back, the administration announced that it was cutting $11 billion in COVID related funds that were flowing through the CDC, through NIH, and often out to the states. And as Spreeha described, there's been a bit of control F approaches to cutting certain funding streams. And that's exactly what happened here. So a lot of COVID funds were intertwined with other funds. And so that meant that immunization cooperative agreements to the tune of $6.5 billion, which is money that goes out to the states to support their immunization programs, were really wrapped up in this. And the states said, this is not COVID funding. This is not what this money was for. And so the CDC, HHS indicated that it would provide some clarification on which funds were being cut. In the meantime, 23 states sued HHS and received an injunction in those 23 states to stop those funding cuts. But it remains to be seen whether HHS will clarify that states can continue to receive these immunization grants, and beyond that, whether these funding cuts are allowed to stay in place. But again, that only applies to those 23 states. And we've heard plenty of reports that states are laying off, some of their workforce, that they've eliminated contracts with some of their outside contractors. And so a lot of this, in my view, once it's taken away, is not going to be, you're not going to be able to put it back in place. And so the damage to the nation's public health enterprise at the federal, state, and local level, is really going to be long lasting.
So, yesterday, while the ACIP was actually taking place, Secretary Kennedy held a press conference to discuss research into autism spectrum disorder. Richard, could you tell us a little more about what the secretary discussed during that press conference?
The secretary basically came out and said that by September, the research will be done to determine the cause of autism. And he insisted that autism is not something that is genetic, that it's, caused by environmental factors. And essentially, the word vaccine was not mentioned at all during the press conference, but we know because there's a well-established track record that Robert F. Kennedy Jr. has perpetuated the myth that there's a link between vaccines and autism. And if you go back and you look to the 1980s, we were increasing our ability, enhancing our ability to diagnose autism cases. And that coincided with a lot of measles outbreaks in the country as we were really trying to close those last gaps in making sure that we were vaccinating all children against measles. And so around 1989, we saw another enhancement in our diagnostic criteria for autism spectrum disorder. And we saw the implementation of a second dose of measles vaccination. And so correlation does not equal causation. There are many strange correlations between events out there. For example, as the number of Marvel movies produced has increased over time, we have seen a reduction in the number of farms in the United States. Those two are not related at all. But that myth was really perpetuated further by a paper that was written by Andrew Wakefield and published in 1998 in The Lancet, suggesting this link. It was based on junk science. It was later retracted, and The Lancet issued an editorial, really expressing their regret for publishing the paper. Andrew Wakefield lost his medical license in the United Kingdom for that, and the anti-vaccine movement have continued to perpetuate that myth. So I think what we're seeing is this slow march toward getting the prefabricated answer that there's a link between vaccines and autism. And I think when I say a slow march, I think what is happening is this sort of proceeding cautiously toward, getting that answer while sowing doubt and misbelief in the public mind about the causes of autism, saying we should look into it, we should try to understand it better, we should conduct studies. And to a rational person, that sounds like something we should do. But the reality is, the research has already been done and it has disproven any link. And so to suggest otherwise, I think is really irresponsible. And it is going to be damaging to confidence in vaccines in this country. It is going to cause the kind of lower rates that Anna was describing, and it's going to cause disease outbreaks. And children, maybe some adults, will die of vaccine preventable diseases as a result. We saw that happen in Samoa. We saw 83 children die after immunization rates plummeted, I think around 46%, the studies showed. And so, are we seeing a repeat of that in the United States, or will we see a repeat of that? Potentially.
Thank you for that, Richard. And I think that puts a point on my warning earlier that this was not going to be an optimistic podcast, but an informational podcast nonetheless. So I think we can begin to wrap up our discussion with that, and I'll try to end it on a somewhat positive note if we can. So I'm going to ask all of us, including myself, two questions. First, what gives you hope for our continued ability to prevent diseases with vaccines? And second, as the ultimate palate cleanser, what was the last cute thing you saw? So I'll start first. What gives me hope about our continued ability to prevent diseases with vaccines? I have a 1 year old, and we live out in the suburbs of Washington, D.C., and we go to a great pediatrician practice. And they are great pediatricians. I will say they are not great social influencers yet, but they have nonetheless started to try to talk to their patients on Instagram and posting reels and information about the measles outbreak that Anna covered. And I think it's great because everyone says health happens at home, not in the doctor's office, but people trust their doctors. So the more that they can talk to them in new and innovative ways like Instagram reels, it all helps, especially hearing from your doctor who maybe you only have 15 minutes with, than to hear them slowly explain the measles outbreak later. And they don't get paid for this. This is just something they're doing on their own time. I think that the more doctors can do that, the more informed we'll all be, and hopefully the safer we'll all be. So I take that to heart. As a palate cleanser, this morning, one of my dogs, I have two dogs, one of them was so excited for breakfast, she jumped on the other dog and started pulling him by his ear. So next, Anna.
Oh, yeah, well, thanks. So your first question is a hard one to answer because the headwinds are so real. I mean, misinformation, access gaps, politicization of vaccines, the list goes on. I think I would your example there of the hyper localization of vaccine information, it definitely gives me hope. For me, it's also a personal story. So, like Will, I am a new parent. And last year, I was fortunate enough to receive the maternal RSV vaccine. And that really gives me hope in just the power of innovation in this space. I actually started my career years and years ago looking at the burden of disease for RSV in very young children. And so for me, it was a really full circle moment to get vaccinated and know that I was protecting my child from this disease. And so I think there are a lot of us out there that really believe in the power of vaccines and that and have hope. And so that gives me hope. And I think in terms of the ultimate palate cleanser, also very dog related. Um, I'm not looking at uh, doctor reels. Actually, I'm a new parent. Of course, I'm looking at doctor reels about healthcare for young children. But I'm also looking at this dog account called We Rate Dogs, which is the ultimate palate cleanser always because they just have really cute dog videos all the time. It's basically like America's Funniest Home Videos, but dog edition, and you see anything from like a dog eating a mozzarella stick that goes on and on and on, to, two dogs saving an injured dog from the streets, very heartwarming and sweet. So it's always nice to turn to our canine friends for a little bit of relief from the vaccine news of the day.
Spreeha?
What gives me hope? This is actually, a really great question. I think I'm relatively new in this vaccine space, right? I started working at EBG and then I started working with Richard, and that was really my introduction to ACIP vaccination. And also an introduction to all the people who work in the space that we get to interact with every day. And I will just say that the caliber of people that we get to work with, that we get to talk with, is very high. Everyone is incredibly smart. And more than that, everybody is incredibly caring. This is a mission that they really, really, really care about, and are willing to fight for. So we have some really good people who are, fighting every day to make sure that everybody has access to vaccinations. So that gives me hope, definitely. And the cutest thing I saw, so recently my parents got some birds, and my dog is obsessed with them. So when we take her to grandma and grandpa's house, she sits by the bird cage for hours and watches the birds and wags her tail.
That's cute. Richard?
Yeah, so I think there is hope, and I think we just have to look at the sweep of time. I thought during the COVID pandemic that the interest at the beginning of the pandemic in epidemiology and public health, in vaccines, I thought the general public was really going to, because they were so interested in all of these things, that confidence in vaccines was going to increase, and that we were turning a new page with respect to vaccines. And I think what we saw was the opposite. And I think that's really unfortunate. But what gives me hope is if you look back at the sweep of time, we've seen vaccine skepticism over and over and over again. The first vaccines that were invented by Edward Jenner, because he used cowpox to develop the vaccine, people thought that vaccines would turn them into cows. People thought that once we ended a lot of the outbreaks of smallpox that were occurring in the United States in the early 1800s, that we didn't need to vaccinate anymore. And we realized that without vaccination, we continued to see outbreaks. And so we went back and reinstituted those policies. It doesn't mean that we always need to get all vaccines and they need to be mandated. It's until we eradicate these diseases in their entirety. So we continued to see smallpox outbreaks in the United States until the 1950s. And then about 20 years later, we realized we don't need the vaccine anymore because it actually has been eradicated. And so I just think as you look back at, again, this sweep of time, there are ebbs and flows to these things. And I think we will see a day where confidence is restored in vaccines, where public policy really reinforces the importance of vaccines again. So I think we'll get back there. The cutest thing that I've seen lately is my best friend's daughter reading a book that I gave her.
Well, look at that. We were able to end on a happy note. So thank you, Anna, Spreeha, and Richard for taking the time to participate in today's discussion on vaccines and the Trump administration. Thank you to all of our listeners. I'm your host, Will Walters. If you like what you've heard today, please don't forget to subscribe. Diagnosing Healthcare is available wherever you get your podcasts. We'll see you next time.
This podcast is presented by Epstein Becker Green, PC. All rights are reserved. This audio recording includes information about legal issues and legal developments. Such materials are for informational purposes only and may not reflect the most current legal developments. These informational materials are not intended and should not be taken as legal advice on any particular set of facts or circumstances, and these materials are not a substitute for the advice of competent counsel. The content reflects the personal views and opinions of the participants. No attorney-client relationship has been created by this audio recording. This audio recording may be considered attorney advertising in some jurisdictions under the applicable law and ethical rules. The determination of the need for legal services and the choice of a lawyer are extremely important decisions and should not be based solely upon advertisements or self-proclaimed expertise. No representation is made that the quality of legal services to be performed is greater than the quality of legal services performed by other lawyers.